Hello, everyone. I'm Paul Gordon, and I am the Environmental Health Beat Leader for AHCJ. This webinar is one in a series of topic-specific training opportunities to brief healthcare journalists on the latest information in a particular health area and give you story ideas and story resources that you can use in your work. In today's webinar, we will discuss how to use the CDC's environmental justice and social vulnerability data in reporting. These databases are vast and can illuminate a huge variety of potential angles that can make your reporting stronger. Climate change is rapidly altering our lived environment, and the ways in which it is affecting our health is evolving, further necessitating the usage of tools like the Environmental Justice Index and the Social Vulnerability Index. Environmental health is a deeply intersectional topic, which opens up the possibility of using lots of different data sets. There are a wide variety of indicators included in these CDC indexes, so it's important to know how to navigate this data so that it is relevant to your story. In this webinar, our speakers will illuminate how to use these powerful data tools so that you are getting the correct data for your reporting. And joining us today, we will be talking with Ben McKenzie and Elizabeth Pembleton. Ben McKenzie is a geospatial epidemiologist with the Geospatial Research, Analysis, and Services Program, also known as GRASP, at the Centers for Disease Control and Prevention. Since 2021, he has served as the team lead for the Environmental Justice Index Project in collaboration with the National Center for Environmental Health and the Human Health Services Office of Environmental Health. Mr. McKenzie is a committed advocate for the application of geospatial sciences to promote health and health equity. Elizabeth Pembleton received her Bachelor of Science in Health Promotion and Behavior from the University of Georgia and her Master of Public Health in Epidemiology from the University of Alabama at Birmingham. She has worked in various public health areas throughout her career, including nutrition and exercise, healthcare-associated infections, foodborne illnesses, HIV, COVID-19, and most recently, social vulnerability in geospatial science. Elizabeth joined GRASP in July 2020 as the Senior Project Coordinator for COVID-related projects and has since moved to lead the Social Vulnerability Index in early 2022. Our guests will present on how to use these CDC indexes and then answer all of your questions. You can ask questions at any time by typing them into the Q&A space, and I will direct them to our guests. And please be sure to use the Q&A space rather than the webinar chat. So we'll go ahead and get right to it, and we'll start with Elizabeth. So Elizabeth, feel free to start us off.
Wonderful. I will go ahead and share my screen and we will jump in. All right. So yes, good afternoon or morning to everyone. My name is Elizabeth Pembleton. Thank you for the introduction, Paul. And as you mentioned, I'm a geospatial epidemiologist and project manager working within the GRASP team at CDC and ATSDR. And GRASP is the group that is focused on research, analysis, and services within the geospatial space. So today I'll provide some information on the Social Vulnerability Index regarding its history, how it's created, how it's maintained and updated, a couple of use cases, and how to use the information for your own work. All right, so for a bit of history, what came to be known as the Social Vulnerability Index was created in accordance with the Pandemic and All Hazards Preparedness Act of 2006. And this act cited that public health preparedness and response capabilities were critical needs for the nation. So when this act was signed into law by the president, it was a mandate to which all federal agencies were tasked to comply. So CDC decided to build agency capacity in public health preparedness and response by addressing social vulnerability to disasters and public health emergencies. So from this, a group of social scientists and statisticians within GRASP began developing the SVI over 15 years ago in 2007 and released the first iteration of the SVI in 2011. So every single community in the United States exhibits varying degrees of vulnerability to public health emergencies. However, a community's social vulnerability plays an important role in its response to and recovery from hazardous events such as disaster or disease outbreak. So social vulnerability refers to the demographic and socioeconomic factors that contribute to communities being more adversely affected by public health emergencies and other external hazards and stressors that cause disease and injury. So for instance, there are social factors such as poverty that lead to certain populations being less able to prepare for, respond to, and recover from public health emergencies. And it's important to track and measure social vulnerability in order to address social disadvantage within communities and decrease human suffering, health disparities, and health inequities. So we developed the Social Vulnerability Index, or the SVI, as an index, a database, and mapping tool to assist public health practitioners with identifying and quantifying communities most impacted by social vulnerability in their jurisdictions. So to go into a little bit of methodology here, the SVI is composed of Census Bureau data, and we do this and we measure the relative social vulnerability of United States communities. Currently, the Social Vulnerability Index includes data on 16 sociodemographic variables, as we can see on the right side of the slide here. We also group the 16 variables into 4 major themes, which cover 4 areas of social vulnerability, including vulnerability based on socioeconomic status, household characteristics, racial and ethnic minority status, and housing type and transportation. And then we combine the 16 variables, or the 4 themes, into one measure of overall social vulnerability. For SVI, we use percentile ranks to score the social vulnerability of a community on a scale of 0 to 1, with 1 representing the most vulnerable or the highest level of vulnerability. And we have developed and validated SVI databases for US census tracts and counties at both national and state levels, including databases for Puerto Rico and tribal tracts as well. It is important to note that the SVI database for Puerto Rico is a standalone database that is ranked separately from the United States, from the US states. And then the CDC and ATSDR SVI databases for tribal census tracts include data for the 16 SVI indicators, but do not include rankings. And then since starting the development of the SVI in 2007 and releasing that first database in 2011, we have produced 6 different databases for SVI for the years 2000, 2010, and then from there every 2 years, 2014, 2016, 2018, and 2020, which is the most recent currently, but we are planning the 2022 data update for this year. All right, so here we see the SVI 2020 map, in which we can easily distinguish the areas of increased social vulnerability based on the dark blue color. And so one aspect of the SVI that makes it unique from other social vulnerability indices is what you see behind the map here, which is the database that we provide. It's an example of it. So we not only compute an index and provide maps of social vulnerability rankings, but we also provide the raw data, so like the counts and the percentages, that generate those rankings for each census tract and county in the United States. So these data are often pretty useful for people wanting to know how many people in specific vulnerable groups reside in those communities. And this can help focus and allocate limited resources to those most in need. We also provide prepared county maps for every US county in the US, which displays social vulnerability at the census tract level for the specific counties of interest. Our partners have said that they really value these maps because they can take a quick glance and get a good idea of what the varying patterns of social vulnerability look like in their areas. So for an example, this is Fulton County, Georgia, and we see the overall vulnerability map on the left here, and then the 4 maps of the 4 SVI themes on the right. And as you can see, there are some areas that kind of immediately stand out, like the bottom left corner of the county. And we can see that these tracts have moderately high vulnerability in the overall SVI. But on the right-hand side, we can kind of dive into this a little bit more, and we can see the household characteristics theme. This area has the highest level of vulnerability. So essentially, these prepared county maps are just a useful way to quickly understand the community. And then regarding the utility of the SVI, the SVI has been used by several federal, state, local academic partners for a variety of purposes. So our tool has been used to help with understanding the association between social vulnerability and physical hazards, such as hurricanes and tornadoes, or planning hazard mitigation and public health funding allocation. And these are among the traditional uses of SVI. And we can also see this covered in the CDC Planning for an Emergency Guidance document, which I can link it to as well. But more recently, we have found that SVI has utility for infectious disease outbreaks, like with COVID-19. And we have seen the use of SVI expanded and used to better understand chronic diseases, such as obesity, injury, mortality, cancer, and physical inactivity. So just to do a quick recap, the SVI combines 16 demographic and socioeconomic variables from the Census Bureau to identify communities experiencing more social vulnerability across the United States. And we provide SVI information for all US Census tracts and all US counties, and we rank them on a scale of 0 to 1, with 0 as the least vulnerable and 1 as the most vulnerable. And the SVI is a tool to assist communities before, during, and after public health crises. So I will now stop sharing my presentation and dive into a little bit of a demo here. So let me pull up my other screen. All right. Are you all able to see my screen? All right, perfect. Okay, so this is our interactive map, which I'll jump into first here. So this has a lot of information in here. This has pretty much everything that we have on our website in terms of the data and the databases that we provide. So we can see over here in the top left, the overall SVI, but we can drop this down and see the 4 themes that are contained within the overall SVI as well. So if you wanted to look at a specific theme, you can do that. The default is to have this as the nationwide comparison, but you can also look at a specific state. So if you're interested in looking at, say, Georgia specifically, you can switch to a statewide comparison and look at Georgia. And this will show you the counties in this case compared to all other counties within Georgia. So it's a little bit more specific than if you're looking at a county compared to all other counties within the United States, which is the nationwide comparison. And then we also have either counties or census tracts, but do note that you need to be at a zoom level of 8 or higher to be able to see the census tracts. And otherwise we'll be looking at the counties here. And we can also look at the different years of the databases as well. And then within here we have all of the counties. So you can hover over and see which county, and then you can click on it to see what the score is for that county. And it provides a little bit more information about that county's SVI score. And then, of course, we can zoom in, zoom out, go back to the full extent. And if you wanted to do a specific selection, zoom selection, you can do that as well. Now I'll show also we have our table tab, which provides all of the information within the data sets. So, and sorry, this is not necessary, the error message. It's still showing the information here. And it has where you can hover over and see what the variables are, but you can also click here to download the data dictionary, which provides information for each of the variables. You can also download the data, and on the previous page, you can also download the map as well. These are also color-coded into the themes. So a lot of rich information here. And this also we can filter essentially into whatever data set or data information that we're looking for. And then lastly, on the interactive map, we have our more information where we have additional resources, the recommended citation as well. And then this is where you can get to the prepared county maps. So you can select the state that you're interested in, the year that you're interested in, of course, and then the county after you select a state. So that is the interactive website, but I will also show you just the home screen for SVI as well. And this has where you get to all of the information as well. So this is our home screen where we post any news and updates and any highlights of maybe recent uses of the SVI. We have the link to our interactive map over here on the left or up here on the right. And then this is probably one of my favorite pages that we have, the data and documentation download page. This is where you can get all of the information. Again, this is very similar to the information that we show on the interactive map on that table tab, but this is a way to download this incredibly easily, have all of the information for you to filter and sort and play around with. So we have the year that you're interested in, and then we have whether you're looking at the nationwide comparison, so this would be the full United States, and then we have all of the different states and territories, and including the tribal tracts as well. So you can download the data here. And then we have the either census tract or county. So whether you're interested in which geography type, and then tabular format, so the CSV or map information, so a geodatabase. And then underneath here, we also have, again, our citation recommendation, and then all of the documentation for each of our data sets as well. So the documentation has just a ton of information. It's a rich source of information to read through and get a great sense of the SVI. And in this, we do also provide, as you can see here, we provide the data dictionary, which is actually searchable. So if you're interested in a specific variable, you can search here. So again, I think this is a really helpful section of the website. Then we also have our publications and materials page, which we actually just updated last week with this additional table here, which has over 500 different publications that use SVI. So if you're interested in a specific topic, for instance, you can search for a topic based on these keywords and find some publications that use the Social Vulnerability Index. And then we have other materials that use SVI as well. So white papers, and then different websites that utilize SVI. And then we also have a training video, specifically this one that's very helpful as like an introductory video. So then just really quickly last, we have FAQs, which are again very frequently asked, so a great place to come for some questions that you might have, SVI at a glance, and a quick fact sheet about SVI as well. So I think that is everything for now, and I will go ahead and turn it over to Ben.
Before we turn it over to Ben real quick, I'm just gonna interject one question that might be relevant, and then we'll
Sure.
go to Ben, and then we'll do some more Q&A at the end. But are there plans to expand the scope or granularity of the data sets in the future to capture additional dimensions of environmental health disparities?
Yes, so maybe not specifically environmental health disparities at this point. We're still looking, we always look for different variables that we might want to add or change going forward with every database release that we have. But in terms of additional granularity or additional things that we are going to be adding for SBI, we are looking at adding ZICTA data. So that's zip code tabulation area data, which is a proxy for zip code information. So we are looking at providing those data hopefully this year, later this year, and also providing a regional comparison. So that will be helpful if you're looking at areas, let's say in the Southeast, where you want to look at Georgia and Alabama compared to each other, but you don't necessarily want to muddy up the comparison by including like Alaska information as well. So we'll have a national comparison that looks at all counties and all tracts in the US. We'll have statewide comparisons, and then we'll have a regional comparison that's a little bit in between the national and the statewide. So hopefully that answers your question.
Yeah, absolutely. Thank you. Okay, sorry.
Wonderful.
Back to you, Ben.
Thank you so much, Paul. Let me go ahead and share my screen here. Okay, so thank you so much. Good afternoon, everyone, or morning, depending on where you are. And thank you so much for attending, and also to Paul and AHCJ for organizing this event. As Paul mentioned earlier, my name is Ben McKenzie, and like Elizabeth, I'm a geospatial epidemiologist with the Geospatial Research Analysis and Services Program, or GRASP, within CDC and the Agency for Toxic Substances and Disease Registry. I identify as a white man, and my pronouns are he, him, his. For descriptive purposes, I'm wearing a purple dress shirt, and I'm joining you through Zoom with a blue CDC and ATSDR background behind me. I also want to acknowledge that I'm joining this presentation from the traditional lands of the Cherokee and Muskogee peoples, and to pay my respect to elders both past and present. And today, as Paul mentioned, I will be presenting to you all on the Environmental Justice Index, which expands some of the work previously done through the Social Vulnerability Index, and which CDC and our partners in the federal government and beyond are using to advance environmental justice and health equity through data visualization. So I just want to start with some quick terminology just to get everyone on the same page, to let you know what we at CDC mean when we talk about concepts like environmental justice and health equity. So I want to start with the term environmental justice. Environmental justice, as defined by CDC, is advancing health equity and eliminating environmental health disparities through the fair treatment, meaningful involvement of all people in environmental health policies, research, and programs, as well as ensuring equal access to a healthy environment. Now, this term is very closely linked to our next term, health equity. And health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. And our definition of this acknowledges that achieving health equity requires focused and ongoing societal efforts to address historical and contemporary injustices, to overcome economic, social, and other obstacles to health and healthcare, and to eliminate preventable health disparities. So much of our health is influenced by environmental factors, things like exposure to chemicals, odors, or noise pollution, and the quality of our built environment. which means that environmental justice and health equity are inextricably linked. You can't have health equity without first addressing environmental injustice. The next term I want to mention here is a bit more complicated and a bit more specific to EJI. It's cumulative impacts. Now, cumulative impacts are a measure of the total harm to human health of multiple environmental burdens, chronic health conditions, and social stressors. Finally, the final term I want to address is social determinants of health, which I'm sure a lot of folks are also familiar with. And these are the non-medical factors that influence health outcomes. They are the conditions in which people are born, grow, work, live, and age, as well as the wider set of forces and systems shaping the conditions of daily life. Now, addressing the social determinants of health with the goal of promoting health equity is a key focus of Healthy People 2030, which is the U.S. Department of Health and Human Services flagship framework of 10-year goals and objectives for the nation's health and well-being. This framework makes it the mission of our nation's health programs, like CDC and ATSDR, the Agency for Toxic Substances and Disease Registry, to eliminate health disparities and to achieve health equity. These concepts of cumulative impacts and environmental justice are, again, inextricably linked to those social determinants of health and health equity. So now that we've got a shared vocabulary and a shared understanding of some of these concepts, let's talk about them in terms of our Environmental Justice Index. The EJI, which was developed by CDC and ATSDR in partnership with the U.S. Department of Health and Human Services, Office of Environmental Justice, is the first national place-based tool designed to measure the cumulative impacts of environmental burden on health through the lenses of environmental justice and health equity. And I defined cumulative impacts just a moment ago, right? The multiple environmental, social, and other stressors present at the community level that can build on each other and interact to produce patterns of health and well-being. We know that individual factors, like conditions in our neighborhood and our built environment, don't act on our health in isolation. Environmental factors like pollution and built environment can interact with each other, along with social factors like racism, poverty, and education, and health vulnerabilities from pre-existing chronic diseases to compound effects and impact a community's health and well-being, which is why it can be so important and so powerful to measure these factors together in a way that accounts for these compounding effects. The EJI provides a single score that distills data on environmental, social, and health factors into an understandable measure that can be used for context and comparison when thinking about how to address injustice and promote health. I also want to make sure to highlight that the EJI does this at the community level, visualizing the relative impacts of injustice on health for census tracts across the United States. Over here on the right, you'll see what that looks like for DeKalb County, Georgia, which is where I live and work. This map, taken from our EJI Explorer, which I'll show you soon, shows what level of cumulative impacts on health might be facing communities in my county. And I can already start to see that many communities in my county, those in the darkest shades on the map, experience a high level of injustice and impacts on health relative to the rest of the country. In just a bit, again, I'll demonstrate how to use this interactive mapping tool to go further in exploring these data. But for now, I want to focus on how we created the EJI. I also want to clarify that the EJI score is not intended as a definitive label, but as a tool for contrast and comparison. And I'll get more into that in just a bit too. I also want to mention the EJI builds on existing environmental justice and cumulative impact screening tools and methods, taking a framework that was actually developed at the state level, a framework called the Environmental Justice Screening Method, and applying it nationally in response to calls for a nationwide approach to measuring and addressing the impacts of environment and injustice on health. So here's a little bit about the methods that we use to calculate and create the EJI. Like the SVI, the EJI uses data from the US Census Bureau, as well as data from the US Environmental Protection Agency, the US Mine Safety and Health Administration, and the CDC to rank relative cumulative impacts in communities across the United States. The unit of analysis and display of the EJI are census tracts, which are subdivisions of counties that are commonly used to show neighborhood-level data. Each census tract has an average population of about 4,000 people, and while they're not perfect representations of neighborhoods, they are a useful representation for which we have consistent nationwide data. There are about 72,000 populated census tracts in the United States, and EJI scores are available for most of these, with some notable exceptions in Alaska, Hawaii, and US territories, where we don't currently have sufficient, particularly environmental data, to draw nationwide comparisons. Though working towards providing what data we can for these areas is something that we are looking into. Now, the EJI itself consists of 3 modules, representing what we see as the 3 building blocks of cumulative impacts: environmental burdens, social vulnerability, and health vulnerability. These 3 modules include a total of 36 indicators, each calculated using nationally representative datasets from the agencies I mentioned before, and each measuring a distinct environmental, social, or chronic health condition that contributes to overall cumulative impacts on health. Like the SVI, the EJI uses a percentile ranking method to calculate scores, meaning that each indicator score, as well as the overall EJI score, represent the value of those scores for a given census tract relative to all other census tracts in the United States. This percentile rank indicator score, like the SVI, is represented along a 0 to 1 scale, which means that a score of 0.85 for a given census tract would mean that the tract in question ranks higher for that indicator or other score than 85% of all other census tracts in the nation. Now, following the peer-reviewed and tested methods used by other tools, like the CDC ATSTR Social Vulnerability Index, we calculate scores for each of these individual modules within the EJI by summing indicator scores and then percentile ranking the summed scores. Finally, we calculate an overall index score by summing and then percentile ranking those 3 module scores. And again, this means that all scores represented within the EJI measure how a given census tract compares to other census tracts in the nation using that same kind of 0 to 1 percentile ranking scheme. These methods are, again, peer-reviewed and tested as they've been widely used by other tools. They're also relatively simple and easy to communicate to a range of users with varying backgrounds. And finally, these methods are easy to adapt to local needs and circumstances. I want to mention also that all of the data used in the EJI had to meet a set of criteria in order to be considered for inclusion. These criteria ensure that the EJI is nationally consistent and nationally comparable, as well as being transparent and reliable. Our first criterion was that all data had to be from a trusted source, such as a government agency, a source that could be relied upon to produce accurate data and to continue to produce data in the future. Data also had to be analytically sound, meaning that they had to be a quality measure of the indicator that they're intended to represent, with support from the scientific literature for their explanatory power. Data had to be available at scale, which means that they had to be at that census tract level or some finer resolution. And then finally, data had to be timely, meaning that they had to represent relatively recent conditions, mostly conditions within the last 5 years, and that they had to be updated regularly so that we could use them for future updates to our tool. Applying these criteria to a potential set of indicators identified through literature review and subject matter consultation resulted in a final list of 36 indicators that satisfied all criteria, including 17 indicators representing environmental burden, 14 indicators representing social vulnerability, and 5 representing health vulnerability. And I'll show you a place where you can learn a little bit more about these indicators in just a moment. Now, there are several very important limitations to consider when using a tool like the EJI. First, the EJI does not label environmental justice communities. We know that environmental justice communities are often among those experiencing the most severe cumulative impacts, but applying that kind of label is outside of the scope of this tool and is an inappropriate interpretation of the EJI. It's also important to note that the EJI does not characterize all relevant environmental issues. Because of the necessary data criteria that I mentioned before, there are relevant environmental and other factors that are not included in the EJI because no national data sets representing these factors currently meet our criteria for inclusion. These include things like drinking water quality, agricultural pesticide exposure, and vulnerabilities related to reproductive health. This means that whenever possible, information from the EJI should be supplemented with local data and information to provide a clearer idea of cumulative impacts on communities. Another very important consideration is that the EJI, like other cumulative impact screening tools, is not designed to tell a community or individual their risk or level of exposure from environmental hazards. These tools take a high-level screening approach, meaning that they're useful for providing context and comparison, but they're not a substitute for health risk assessments or other more detailed and quantitative approaches. Finally, I want to acknowledge that the EJI and other environmental justice mapping and screening tools are not a silver bullet for addressing environmental injustice and health inequities. These data are intended to start conversations, not to end them, but they can be invaluable tools for champions of environmental justice and health equity. So how do we envision the EJI actually being used? Well, the EJI can be used to do things like identify and prioritize areas that may need special attention or additional action to improve health and health equity, to educate and inform people about the environmental, social, and health factors driving cumulative impacts at the community level, to analyze those unique local factors driving cumulative impacts on health in order to inform policy and decision-making, and finally, to establish meaningful goals and measure progress towards environmental justice and health equity. And with all that in mind, let's go ahead and take a quick look at some of the resources that we make available online to learn more about the EJI and interact with EJI data. So this is the landing page for the EJI, which can be found at eji.cdc.gov. And you can find here a number of resources on how to use and interpret the EJI, including our online mapping tool, the EJI Explorer, which I've got pulled up over here on the right. So this is the EJI Explorer, an online tool open to the public that can be used to visualize and interact with EJI data. Here at the top, we have links for an accessible data option for the vision impaired, an email address to submit feedback on the EJI, and an option for data download, which I'll show in just a moment in this demonstration. The EJI database includes the overall scores for the index, as well as scores for all constituent parts, just like with the SDI. However, the map is the real star of the show here on the EJI Explorer, displaying relative scores for census tracts grouped into quartiles. This means that the tracts shown in the darkest shade here experience more severe cumulative impacts on health than at least 75% of all other tracts in the nation. Now, the Quick Start Guide over on the left here can walk you through ways to focus in on areas of interest in order to dig deeper into these data. For example, applying a state and county filter will take you to that county, giving you a broader overview of relative cumulative impacts across that area. So I'm going to go ahead and navigate to DeKalb County, Georgia, again, where I live and work. And you can again see these relative scores across the county. Selecting a particular census tract within that county will bring up this pop-up that gives you information like the population of that tract, as well as those percentile rank scores for overall cumulative impacts, that EJI rank, as well as scores for environmental burden, social vulnerability, and all indicators included in the overall index. Now, clicking on one of these indicators will take you to a page on the EJI or on the ATSDR Place and Health site, part of that eji.cdc.gov domain, which will give you information about all of these indicators, including the exact measurement that indicator is making, the year or years that the data for that indicator was collected, the source of those data, and the rationale for how that indicator contributes to overall cumulative impacts on health. Navigating back to the main landing page, you can also find a number of resources on how to use and interpret the EJI, including clicking on this EJI resources page, a downloadable fact sheet that gives you an overall overview of the EJI, as well as a series of FAQs and guidance documents on how to use the EJI at state and local levels. We have a few more pages, including this one, where you can find detailed techniques on theory, methods, and the scientific basis for the EJI. This documentation, which is pretty extensive, includes details on our model, on indicator calculation, and even some example index calculations for census tracts that graphically display how data are transformed and combined into indicator scores. Going back to the main page, we have that EJI indicators page that I showed before, as well as an option for data download, also accessible through the Explorer. On the download page, like with the SVI, you can specify your geography of interest with options to download the entire data for the entire US or for specific states. Unlike the SVI, at present, all rankings that are downloaded represent national comparisons, even if you only download EJI for a specific state. We also do not currently have multiple data years available, as this is a relatively newer tool. And finally, like the SVI, you can specify whether you want to download these data as a regular CSV tabular format or a GIS-compatible geodatabase file. And the EJI data dictionary is also available as a PDF download as well. I think the final thing I want to mention as well is going back to our landing page. With each release of the EJI, we provide opportunities for community engagement. As we say here, CDC and ATSDR are committed to engaging with communities, environmental justice experts, and public health partners and academic subject matter experts as part of the development and improvement of this tool. This page is updated when we have new opportunities for community engagement, and also includes links to recordings of previous webinars that we've hosted. And because answering questions and hearing feedback on the tool are so important to us, we have easy links here for users and for media to email us with comments on the EJI. So that concludes my presentation on the EJI tool. Thank you all so much for your time, and I'll go ahead and turn it over to Paul for any questions. Thank you.
Wonderful. Thank you very much to Elizabeth and Ben for helping us frame this topic today. And yeah, as we're going through our Q&A here, I'll just remind viewers that you can ask questions to our presenters by typing them in the Q&A window, which I see some folks have already used. So please remember to use that instead of the chat. And so, yeah, I'll get us going with a question here. So Ben, I know you talked a little bit about this for some of the things that EJI is not intended to be used for. And I just want to expand on that a little bit and perhaps include the social vulnerability index in there. So have you seen people or journalists misinterpret the data in these indexes? And if so, why do you think they did? And then additionally, how can healthcare journalists avoid these pitfalls?
So I can start, Ben, and then you can jump in with anything additional. But I think one of the things that we do see sometimes is, as Ben mentioned, sometimes it's easy to forget that these are place-based measures. So these are based on census tracts or counties of interest, and these are not meant for individuals. So it's not meant to assign a specific social vulnerability score to an individual. It's about the communities in which they reside. So it's the census tract or county in which they reside that the social vulnerability score is assigned to. So that's a tricky one sometimes to remember when you're trying to talk about certain populations or individuals, but that's a really key thing to remember when talking through this information.
Thanks, Elizabeth. Yeah, I think that's a great point, is people will sometimes want to make inferences about individuals or perhaps an individual place within a county or census tract, when it really is much more appropriate to speak about this at the actual geographic or population level that we're talking about. So that's definitely something that's important to consider. Another important thing to consider that I've definitely seen people kind of fall into with using these tools is kind of aggregating information up or down. So with the EJI, we only provide it at the census tract level because we're very kind of focused on quantifying these cumulative impacts at that level. We feel that that's the most appropriate level at which to measure them. Also, a lot of the data that we have are available at that census tract level. And so people will sometimes want to do things like take averages of multiple census tracts, combine those kinds of scores or something like that, maybe to create a county level measure or a state level measure and compare average EJI scores for different states. And that's not an appropriate use of this tool. We really do recommend that you keep in mind the level of geography, the level of population at which the tool is intended, and apply it appropriately. And again, we have all of this information on our websites. We've got some of those questions about some of those big pitfalls in those FAQs, as well as some guidance on how to use and interpret these tools in our fact sheets. So I would definitely recommend that folks make use of those, as well as feeling free to reach out to us at those emails that we've listed if you have any questions on using the tools appropriately. Thanks.
Absolutely. Thank you. Yeah, and then maybe an appropriate next question, and I want to make sure I'm getting this one right. So for the attendee that asked this, yeah, feel free to clarify in the chat. But the question is, and this is from our Q&A, how do you navigate ethical considerations when using sensitive data related to the Social Vulnerability Index and the Environmental Justice Index? And some of these ethical considerations that this person mentioned were further marginalization of vulnerable communities, consent, and data security. And so this person is wondering, how do we ensure that the benefits of this research are outweighing the potential risks?
Absolutely, and I can hop in on that one first, and then Elizabeth, if you want to add anything. So first of all, I want to specify that the data that we use for the EJI and the SCI are all publicly available data sets. So for social vulnerability, again, we're using data from the United States Census Bureau. That's data that they collect. They also provide their own kind of levels of kind of statistical noise, as well as some other methods to make sure that individuals are not identifiable through those data. So that's actually a very key part of the Census Bureau's mission. And then so those data are not personally identifiable. Same thing with our health data that we use within the EJI. Those data are nationwide estimates based on surveillance, as well as some demographic data from the US Census Bureau. All of those data are, again, publicly available with the necessary precautions taken to avoid any kind of possibility for personal identification. So there are lots of safeguards in place for how those data are being collected and displayed. That means that there are margins of error associated with all those data, which is something that both of our tools recognize and report on. So that's also something definitely to keep in mind. But I think that kind of maybe gets a little bit at those questions of personal identifiability, and also all of those data collections are taken with the absolute consent of the people involved in them. So I can refer you to the policies of those kind of data collectors if that's of interest. The other thing I want to get at is that question of making sure that these data are not used to further marginalize already impacted or marginalized populations, because that is definitely something that is an incredibly important consideration. So one thing I would say to that on the EJI side is that, again, we do try to make very clear what our data are representing, that our data are not, applying these kinds of labels, saying that because you live in a community with high cumulative impacts, you're at risk, or you're living in an undesirable area. Instead, again, it's much more appropriate to interpret our data as relative comparisons for these multiple kinds of conditions. And that's something that we really try to emphasize everywhere within our tool, is how to interpret these data appropriately in order not to further marginalize those communities. But it's something that comes up whenever people are talking about these kinds of data tools. And one thing I will say, again, to kind of get at this point, is that we aren't producing these tools. We didn't produce the EJI just because we wanted to produce something like this. It's not something that just kind of came out of nowhere and we said we wanted to do this. There have been calls from community level activists as well as experts on environmental justice for over a decade now, asking for tools like this, and also examples of it being utilized, again, mostly at the state level, to advance environmental justice and health equity. So there's a large amount of kind of precedent, as well as reasoning for how and why we produce these tools, and how we talk about them, to make sure that, like you said, we're not further marginalizing or stigmatizing communities, but are instead directing resources, directing action to address health inequities and promote health equity within those communities.
I have nothing to add. That was perfect, Ben. Thanks so much.
Great. Yeah, thank you. That was a great question. Okay, yeah, so we have two more that we'll run through here. And Helena wants to thank you all for walking us through this, and is curious when the 2022 data will be publicly available.
So yeah, I'll jump in here with the SVI information. So we do update every 2 years. So this is an update year. So we will be providing the 2022 data this year in 2024. The ACS releases their data in December of the previous year. So essentially, they just released their data for 2022 in December of 2023. So we are currently in the process of updating the data using those ACS data from the U.S. Census Bureau. We are currently in the process of updating, so I don't have a specific time frame for when these data will be available specifically, but definitely this year. And yeah, I'm sorry, I wish I could provide a more specific answer in terms of a date or even a month, but I don't have that information right this second. But if anyone is interested in getting a notification, essentially like an email, as soon as the data are available, I didn't mention this in my presentation because it was the last slide and I went to the demo and then didn't come back to the last slide. But if you have any additional questions or if you have anything else that you would like to ask about the SVI, the coordinator mailbox, which is svi_coordinator@cdc.gov, is the place to ask any questions. And if you email that email address, I can put your information, your email into essentially like a listserv that we will notify these individuals as soon as the 2022 data are released. So if you're interested in getting those data as soon as they're available, please reach out to SVI_coordinator@cdc.gov, and we will keep you posted.
Wonderful. All right, thank you. And for our last question, this is for both of you. What kind of stories would you like to see reporters do with this data?
That's a great question, and also definitely a little bit of a tricky one, I think, for us to answer. I think I want to be careful about how I answer this, but I think I would just kind of like to see people keep these resources in mind when individual kind of cases come up, right? When you hear about something related to environmental injustice or health inequities, these would be a great kind of first stop, data tools for thinking about putting some of that into context. So I don't know that there's a specific place that I would kind of direct people to start. But again, they're a great high level entry to that kind of question. Where say that there's a place that you're interested in looking at. You could use the EJI to identify how that place compares to other places close by, maybe to the place where you live. You can look at some of those individual indicators, see which of those might be kind of driving those high levels of cumulative impacts within that community, and use that as a starting place to dig a little bit deeper, to learn a little bit more about the actual environmental and social conditions present. So again, I think I would just kind of advocate for using especially the EJI as a first stop place to kind of look at some of these aggregate and individual data in order to dig down a little bit deeper and frame the story.
Yeah, I think that's a perfect response. And one other thing I would say is I think hopefully these can be really helpful data visualization tools as well. So tools to use to provide some additional visuals for stories or whatever else you might be working on. It's very helpful to have that map or that information in a way that hopefully helps make sense to people a little bit more than just like a statistic or something. So sometimes visualizations can be a really powerful tool.
Excellent. Yeah, thank you for those answers. That's deeply helpful. And I think we can go ahead and call it there. Thank you to all who joined and tuned in today. If you joined us late, you can find the recording of this webinar at healthjournalism.org in just a few hours. And once again, I want to thank our presenters for taking the time to share their expertise. It was super insightful, and yeah, thank you again. AHCJ will continue to bring you webinars on a variety of health topics as a perk of your membership. So thank you for joining us today, and good luck on your stories.